While we are working in our obesity clinic, there are some commonly asked questions, and I would like to emphasize the answers of them on this International Women's Day 2026. Hello, this is Dr. Reema Kashiva, Director of Center of Excellence for Diabetes and Obesity, Noble Hospital, Pune, Maharashtra. While we are working in our obesity clinic, there are some commonly asked questions, and I would like to emphasize the answers of them on this International Women's Day 2026. First of all, to all the women out there, wish you a very, very happy International Women's Day. So the first thing that is very frequently asked is, Doc, is obesity more common in women? And if yes, why? So yes, obesity is more common in women, and the reason for this is there are certain hormonal differences between a male and a female. The hormones which are there in females are estrogen and progesterone, and they have some different mechanism of action that makes a woman more prone for weight gain. And the fourth hormone, that is leptin hormone, is also responsible to a great extent because leptin hormone distributes the weight in a woman's body differently as compared to in a male's body. So that is why it is more common than in males, and not just that, obesity in a male, in a female, and in a pediatric population all have different characterizations and are different from each other. And why this is important to know is because unless we know it is different, we cannot address in terms of the treatment properly in an obese male, in an obese female, and in an obese child. Next that is asked as a question is that do diseases and complications in an obese female are different and are more as compared to an obese male? Again, the answer is yes. So what are the diseases that are more in females is infertility, PCOD. Premenstrual syndromes are more common in obese females as compared to non-obese females. Premenopausal, perimenopausal, postmenopausal symptoms are more common in obese females as compared to non-obese females. PCOD is more common in obese females. Another set of diseases like breast cancer, cervical cancer, they are more common in obese females as compared to non-obese females. Another set of diseases like osteoarthritis, which is weight related, that are more common in obese females versus obese males. Depression, anxiety, psychosocial disturbance, social pressure, these are more common among obese females as compared to obese males. The next that is asked is there any difference in the treatment modalities in terms of weight management for obese females versus obese males? Yes, there is difference. And the difference is not just in terms of medicines. The difference is overall management of an obese female versus obese male. When we talk about obesity management, the mainstay of treatment is diet, exercise, drugs where medicines and surgeries both are used, and the counseling or the education part. So when I talk about diet, the diet that are given to females are based on the condition of females, like the premenstrual diets are different, perimenopausal diet are different, postmenopausal diets are different. Diet in an obese female associated with comorbidities like diabetes, hypothyroidism, hypertension, heart disease, again the diet is different. So diet itself in an obese female is different from a diet in an obese male. Second, exercise. There are designed exercises for obese females because the fat distribution in an obese female is different than in a male. So where the fat is more, those areas are focused by our exercise specialists and those areas are targeted. Dear women, dear friends, it is not very important for you to hit hard the gyms. It is not important to hit hard the marathons. Just by focused exercises and understanding your body, you can control the weight differently without having much pressure on your brains. Last, when we treat obese females with medicines in terms of injectables, or when we make them undergo surgical treatment or intragastric balloon insertion, there are slight characteristic changes which we have seen in females in terms of tolerability of the drugs, response of the drugs, talking about the drugs, acceptance of the drugs, social pressure of having those drugs. So those characteristics makes a female obese different than a male obese. And last but not the least, education or counseling. Usually males, when they come with obesity, we do not have to focus much on their counseling part, and even if we have to, it is usually a very light type of counseling based on the drugs, diet and exercise. But when we speak to obese females, there are a lot of issues we need to handle, and counselings for these obese females is absolutely different from those counterpart males. So treatment also is different as compared to obese males. So dear friends, what do I want to convey as a take-home message on this World International Women's Day is that all females with obesity come out, visit the clinics which have proper weight management plans for you that differs from a routine monotonous weight management plans. Avail these facility and gracefully come down with your weight and reduce the complications that are associated with obesity. Happy Women's Day once again, and thank you.